We are demonstrating here the natural opening and closing of the mandible, as you can see, with the disc in position and the condyle fixated to the disc that allows for smooth movements of opening and closing and side-to-side movements of the mandible. Now, the disc is supported by several supports. One of the supports is the posterior element, the anterior element, and the pterygoid element. The pterygoid muscle that you can usually palpate to determine if there is pain from parafunction as a result of overexertion of the musculature. Now, consider this as the normal movement. The condyle and the disc move in synchrony. In the event there is parafunction, which is excessive function, or out of the normal function, the disc tends to reposition itself anteriorly in this fashion. If the disc positions in this fashion, then the opening of the mouth is limited by not being able to open wide over 40 millimeters. In the event you cannot open your mouth 40 millimeters, the disc has to be put back in position. The way you do that is you essentially use an appliance. You open the mouth, you keep the pressure off the disc, and you bring the disc back in position. That can be done with a mouth guard, or what we call a repositioning appliance. Sometimes you can do that with one appliance and sometimes two appliances. Anyway, we do want the disc to be functioning smoothly, as you see down here, without excessive clicking, without excessive noise coming from palpation or from patients' complaints of hearing these popping sounds.